Lindsay, this is Libby. I just want to make sure you can hear me okay.
I can. Thanks, Libby.
Thanks.
All right, we're going to go ahead and get started. Let me get situated here. Thank you so much, everyone, for joining us today. I see a lot of familiar faces and some new ones. Thanks to those who are using your videos as well. It's always good to see faces during this time of physical distancing. So thank you all. Welcome to the PFCC Partners May Workshop. My name is Lindsay Galley. I'm the Director of Education for PFCC Partners and will be facilitating our workshop today. I hope all of you have been staying safe and trying to find small sparks of joy during this time. We're really thrilled today to talk to you all about patient-family engagement during a pandemic, such as the one we are in right now with COVID. We have seen healthcare providers, patients, and families rapidly step up in new and innovative ways to respond to COVID-19. And today we will be joined by 2 health systems and 2 patient family advisors who partner with those health systems to learn how they have engaged over the last few months. So before we get started, I just wanted to share some quick tips to using Zoom. I'm sure a lot of folks are getting really used to using Zoom during all of this. And I know that Zoom recently had an upgrade, so your screen might look a little bit different. But you can find some of the most common buttons by hovering over your screen and finding the toolbar. And there you can find the mute button if you have background noise and would like to mute. We also have Laura Jackson on, who is part of the PFCC Partners team, who will be monitoring mute if you have background noise as well. Also, again, please feel free to share your video like I see a lot of people doing. You can turn on your video by finding that toolbar and clicking the Start Video button. And I see a lot of people have found the chat, so thank you so much for doing that. Please utilize the chat throughout today's presentation and discussion. Any questions that pop up, please put them in there and we will be sure to address them at the end during our Q&A portion of today's workshop. And before we get started, I wanted to do a quick poll to see who is with us today. And Laura, do you see the poll on your host screen that you can bring up?
Yes.
All right, great. So we just like to see who is all with us today and what your role in healthcare is. So if you could take just a moment by clicking one or multiple. I'll leave that open for a minute. All right, Laura, if we could share the results. And yes, if you have a other role that isn't listed there, please share those in the chat. Great. Wow, we have a really nice spread of all different roles in healthcare and a lot of patient family advisors with us today. So thank you all for joining. We can close that out. Okay, really quickly, because I want to get to today's content. Our organization is PFCC Partners. Everyone on the PFCC Partners team serves as a patient family advisor, and we utilize our lived experiences in healthcare to support our healthcare partners in designing innovative patient family engagement strategies. Engaging patient and family partners in improvement to co-design policies, programs, and individual care plans for the best possible outcomes. And one of our healthcare partners, being Los Angeles County Department of Health Services, you will hear from today. Oops, went a little fast. Our organization, PFCC Partners, fully supports the Patient Family Advisor Network, the PFA network, which is a national network of over 600 patients and families serving in the role of advisor. It's a really supportive network with weekly coffee chats and really passionate advisors creating guidance and support for each other and all patients and families, like our recent virtual visit patient guide developed by the National IT PFAC that can be found on our website as well. And before I pass it off to Libby Hoy, who is founder and CEO of PFCC Partners, I just wanted to give a huge thank you and shout out to all of the healthcare providers on the front lines. Truly thank you for everything that you're doing to keep patients and families like me and like a lot of us on today's call safe and healthy during this time. So just wanted to take a moment of gratitude and say thank you. And with that, I would like to introduce Libby Hoy, founder and CEO of PFCC Partners, who is going to do some wonderful level setting for our presentations coming up. Libby?
Thanks so much, Lindsay. And before I dive into the level setting, I'll just add my gratitude as well to all of the patient and family members who have moved into the role of advisor and been very active in the Patient Family Advisory Network so that we can understand and raise the voices of patients and families, both within the COVID pandemic response, but overall in designing and co-designing healthcare. It's important, and it's a time that's filled with uncertainty for all of us. So for each of you taking the time to join us today and to voice your thoughts and ideas, it's really important, and we appreciate that as well. So just a lot of gratitude for everyone who's staying engaged and continuing to co-design excellent healthcare. So to level set our conversation today, as we hear from our two guest speakers, we wanted just to kind of frame there's a lot of language going on around there: patient family-centered care, patient family engagement. What do these terms mean? So we don't presume to have it right for everybody, but this is the way that we're looking at it as PFCC Partners, and you'll hear from a similar perspective from our guest speakers today. So we over here, as I often say, are simple folks, so we like to distill things down, complicated concepts down to minimalist language. We look at patient family-centered care as the noun. It's the model of care that we're implementing in the U.S. health system. It's the level of partnership and culture that exists within the healthcare system. We look at patient-family engagement then as the verb or the action strategy. It's how we get there. It's how we build the person-centered health system. And so if we think about patient-family engagement as an active strategy, then we can apply that strategy just the same as you apply any other strategy, be it lean or whatever else. You can apply the strategy of patient-family engagement to improve any outcomes you're trying to achieve, whether that's in the individual's care planning, whether that's in your patient safety efforts, or in your patient experience efforts. Whatever, and we've even gone further. I think that outcome bucket needs to be much, much larger, because we've expanded into patient partnership in research, in measure development, in quality improvement. How do we measure quality if we don't know what quality means to the people that are receiving the services? So patient-family engagement, again, is that layer of strategy into improving outcomes. Next slide. So we often get asked, what do you focus on first? Do you focus on patient-family advisory programs, or do you focus on engagement in the clinical relationship? And the answer is both, because one without the other is not sustainable, right? So if we're devising, if we're creating programs to engage patients in their care at the point of care, but we're not including the patient perspective in the design of those programs, they're likely to miss. And similarly, if we're designing programs with patients and families at the advisory level, but they never get to the care level, then we still have missed that opportunity. So the answer is that we have to attend to both levels. One without the other is not sustainable. Next slide, please. So I've been tossing around the term advisor. We use the term patient-family advisor to refer to those people using their lived experience to influence healthcare. That's a kind of a huge bucket term. Lots of other terms are floating around out there: partners, patient-family advocates, subject matter experts, technical experts. You may hear us refer to all of these different terms, but what we're really talking about are those people who come to these conversations and come to these improvement opportunities from the perspective of patients and families, solely with the intent of bringing that perspective into the conversation so that we're together designing a health system that works for everyone. So with that, I think I'm passing it back to, oh no, I have one more. You're right, Lindsay. Thanks. I've been really neck deep, forehead deep in talking with health systems, with patients and families across the country in terms of how they're being activated in the response to the COVID-19. And I think that's what brings us all here today. This is one of our most popular workshops ever because I think we're all just sort of looking for how we can connect in this time. And so I wanted to share with you a few of the things that I've learned in the ways that patient-family advisors, and that's really going to be our focus today, the patient-family advisory role, how patient-family advisors are serving as that strategic, or as that strategy rather, to respond to COVID-19. So with our friends to the north in Canada, some of the advisors are being trained to be tracers. We've heard a lot about the value of tracing as we move into this recovery phase, and how patient-family advisors may be uniquely positioned to be trained in that tracer role. We want to see patients and families continue to be policy partners. Our colleagues at Plaintree created a pop-up coalition to preserve family presence during challenging times. They convened a huge number of patient-family-centered care leaders from across the country to think together about how to develop a set of guidelines for health systems to address how do we keep family presence, how do we preserve that in this unique state that we're in. And so I'm really excited to say that those guidelines will be published late next week, and we will certainly push that out to all of you who registered for our workshop today. We have partners engaging in effective and compassionate messages, and we'll hear a little bit about that today as well. Your patients and families are an incredible lever and connection to community, and all communities are engaged in COVID-19, right? Who in the country is not thinking of their health and well-being today? And so how do we leverage the connections that patient-family advisors bring to us to really move that more deeply into the community? Gratitude events, advisors have always been good at gratitude events, and I believe in those strongly. I like to start most sentences with the word thank you. Advisors are engaging on incident command center teams to really be at the center and the heart of how health systems are responding, to inform those family presence policies, to inform how things get relayed to the general public. We're offering peer support as advisors to other advisors who are struggling to get their chronic care in this point in time, or who have never been on a telehealth call before, and are in need of that kind of peer support. So these are just some of the ways that patient-family advisors are really stepping up into this space, and we'll hear more ideas in just a few minutes. So with that, I will send it over to Lindsay and let us get started with these fantastic presentations today.
Wonderful. Thank you so much, Libby. That's really helpful. And I'm seeing a lot of folks sharing how their health systems have invited patient-family advisors into COVID response, and advisors also sharing how they have been involved. So thank you all for sharing. Keep those examples coming. We have two really great examples of that today with us. First, we are going to start off with our next presenters from University Hospitals in Cleveland, Ohio. I would like to invite Christy Blackburn, who is the Principal Advisor for Patient Family Engagement, and Lisa Danielpour, president of University Hospital Rainbow Babies and Children's Hospital, on the Patient and Family Partnership Council. So Chrissy, please take it away.
Thank you, Lindsay, and good afternoon, everyone. I almost had to remind myself what time it was in Cleveland and what time it was there in Southern California. Happy to be here, and PFCC Partners, thank you for inviting us to participate today. Next slide, please. So I think it's important to start with just a little bit of background that about 10 weeks ago, I received an email from our Chief Nursing Officer for the Academic Medical Center, and asking that if myself, our Director of Transitional Care Coordinators, and our Director of Social Workers would be willing to lead and be the branch directors of family reunification and patient family reunification, which was falling underneath the operations section of our hospital incident command. We graciously accepted, knowing that a lot was going to need to happen as far as how we were going to connect patients and families, providing education, what sort of social services would we also be able to offer, and looking at how those transitions of care also were happening. This initially started, as I said, at the Academic Medical Center, and we quickly realized, well, one, we're all system physicians, and two, that the whole system would need this as well. So we got that approved by our unified command and put our framework together as far as what we wanted to achieve. So the vision for the task force was really to support patients, families, providers, and staff to maintain a culture of patient family centeredness and compassion, and how this relates to patient safety, quality, and experience during COVID-19. So we used a lot of technology, supportive education for providers and staff, education and inclusion of all patients and families, and the dissemination of social resources. Next slide, please. So at university hospitals, our mission is to heal, to teach, to discover. So we like to keep things fairly simple, if you will. And we decided the mission for this group was to support, to unify, and to connect. Next slide, please. And we had three main goals. So our vision at university hospitals is maintaining the science of health and the art of compassion, which is why we named the task force Maintaining the Art of Compassion. And for those that know me, know that I love acronyms. So we used art to identify our three main goals of accessible social and educational resources, reunifying patients and families through IT, and technology and connection. So our group was made up of very diverse stakeholders. We had palliative care, we had our clinician engagement officer, chief experience officer, IT, marketing, spiritual care services, patient and family partners, as we call them at UH, nursing representation, ED representation, ICU representation. And for many of you that are in roles that are similar to mine, you know this is all about relationships and connecting and having a large web of people around you. So knowing all of these different people across the system, we were able to pull this group together. And with the group, it was about 40 people. And as you can imagine, that's a lot to manage on webinars and conference calls. We started to break down what it was that we wanted to achieve. And we divvied up into two subgroups. So the first was to support. And under that, we have achieved many things as far as we just recently got the approval. We are sending out the COVID-19 Emmy education video to all UH patients, in which we have emails for, with a survey as far as their understanding of the disease after watching the education. We also prepared a document called Be Prepared, and it was focused on COVID-19. And there were three major components of this education that was disseminated out and also put on our webpage that could help community members start having that really hard conversation with families. You know, not necessarily an advanced directive, but what is it that you would want if you became extremely ill with COVID-19 and we couldn't make those decisions for you? So, you know, who would be that health who would be that person that would help you make those decisions if you were no longer able to voice what you needed. We also reworked the language just in the visitation policy. So as you can imagine, you know, as leaders, there's things that we got to get done. They have to get done. They have to get it done quickly. So a number of us looked at it and we said, oh boy, we have some opportunity here for softening up, you know, maybe also offering some of the things that patients could bring into the hospital with them if they knew that they were going to be admitted. So we were also able to get that approved. In addition to that, we also put together from a article that came from MedStar as far as the really tough questions that patients might be asking staff. So we created infograms on what the tough questions were and 3 different answers, you know, that they could potentially use for the patients. As far as our second subgroup, which was to unify and connect, we created several videos or algorithms around virtual family meetings, how to utilize iPads at the end of life, how to conduct a family touch base each day, whether it came from the nurse or the provider. We also created the Get to Know Me document, but I'm going to have our patient family partner talk about that a little more. And also working with development as far as donations, we were able to obtain about $15,000 in donations for iPads and IT. How we were using that with spiritual care services, and also connecting patients and families via iPads or their own phones day to day due to the no visitor restriction policy. So as far as having, we had a number of patient family partners on the task force. We're still meeting here and there, but things are starting to dwindle down a little bit as we put our final playbook together. You know, they did bring that perspective that we just don't think of. And it was an expectation that partners would be on this group. I will say before I pass it over to Lisa that it was just a natural fit. Like there was no resistance, and Lisa just stepped in and she said, I'll do this and I'll do this end of the work. And everyone said, okay. And she created a wonderful relationship with our palliative care physician. So it really just defined where our culture was around engaging partners and how they could assist us along the way during the pandemic. So I'm going to step back and I'm going to welcome my esteemed colleague, Lisa, to speak as far as some of the projects she worked on.
Hi, this is Lisa. I'm so happy to be here. As many of us might have done at the beginning of the pandemic, I was thinking to myself, I wish there was some way that I could help and maybe make a difference, though safely from home. When I got Chrissy's invitation to join this COVID task force, and I jumped in enthusiastically. I didn't feel pressured in any way. We already have a wonderful relationship, but that's part of the UH culture to include patient and family advisors. This was a great opportunity for me also in that because I am the president of Rainbow Hospital, which is the Children's Hospital's Patient and Family Partnership Council, this was working with more of the people at university hospitals on the adult side. So I got to make a lot of wonderful new relationships and learn about so many things that I hope to help with. In the first meetings, I felt like it was really important to listen and get to kind of know all the people and figure out how, as Chrissy said, with 40 people, even in the subgroup that was smaller, I did the To Unify and Connect subgroup. You know, you just want to feel your way and make sure when I'm sharing, as I started to share more and more like of my insights and thoughts from the patient and family perspective, that I'm being respectful of time and the culture and everything. And so, and all of that went, and I really well, I felt very respected, and I started to find these opportunities like the Getting to Know Me poster for the ICU. It was something that the chief of palliative care had been wanting to do. And it fit my kind of communications, digital content technology background professionally. And so what it is there's 2 posters. Getting to Know Me is designed to help the medical team get to know the person as an individual better, as well as what might be helpful in calming and soothing, as well as more difficult for them that a family member would fill out using a Google form. There's also a wonderful family photos messages poster for family members to upload, kind of like get well wishes essentially. And so that is being piloted in some of the ICUs right now. And you'll see a sample I did actually using my son as an example. And as I think PFCC Partners does such a great job through the skills exchange and coaching us about using our family or personal patient experience to inform our advocacy, with sort of making sure we're looking at the broader impact and what we're bringing, like in my case, to helping hopefully medically complex patients. I found it really helpful, and in this case kind of used it as an example of how you could highlight different things. I'm also sensitive, serving on a task force like this, of the confidentiality needs and the discretion to make sure I understand, what's in the room is in the room. And if I'm ever unsure of something that I might want to share outside, that Chrissy and I have a great relationship where I can share and just kind of check in with her. So that is my quick overview. Thank you.
Thanks so much, Lisa. And Chrissy, did you have anything else to wrap up with?
I wanted to just add on to Lisa's point of how the skills exchange training, I really strongly believe now more than ever, really helped for this particular pandemic. Mm-hmm. I mean, and having that under the partners' belts and knowing their boundaries, how to be respectful, what the language is, and the teachable spirit and learning both ways was extremely profound during this time.
Wonderful. Well, thank you for that, Chrissy. And it comes from such a great leader like you, of course. So thank you both, Chrissy and Lisa. We really appreciate you sharing. We will be checking back in with Chrissy and Lisa in just a few minutes. If you have questions, you can put them in the chat box. And again, we will open for questions and answers following our next presentation. And with that, I am very excited to welcome Miguel Renteria from Los Angeles County Department of Health Services. Miguel is the DHS Performance Improvement Team and has taken a real lead in the COVID response there. He is joined by Sergio Quintanilla. Sorry, I wanted to get that right, who is a patient family advisor, part of the Los Angeles County Department of Health Services system. So welcome, Miguel and Sergio.
Thank you, Lindsay. Good afternoon, everyone. And I'm an improvement advisor for Los Angeles County Department of Health Services. Thank you again to Libby and Lindsay for allowing us the opportunity to share this work that we put together in partnership of our special thanks to all of our patient family advisors that helped and shaped this work, and to our Director of Health Services, Dr. Christina Galley, and our Director of Organizational Development for their tremendous support and encouragement in our system's fairly young patient family engagement culture journey. And a very special thanks to Sergio Quintanilla from our San Gabriel Valley Health Center group, who is here today and joining us in this conversation. Next slide, please. A little bit about us. Our mission at DHS is to advance the health of our patients and our communities by providing extraordinary care. We are the second largest system in the nation. We care for approximately 750,000 unique patients annually. Our team is made up of 22,000 members that support 4 acute care hospitals, 26 in addition to providing care to our youth in our juvenile justice system and inmates in the LA County jails. Our DHS family also includes services within Office of Diversion, Housing for Health, and Emergency Management Services. Next slide, please. Very early in our COVID response activities, we formed a COVID-19 oversight committee. Its purpose was to provide a high-level governance and strategy to respond to COVID-19. Our medical, nursing, employee health, human resources, and communications team, to name a few. Our team within improvement was pulled in to support internal community, set up a survey for workforce members to capture and respond to questions, concerns on COVID-19, support weekly town halls, and stand up a centralized system-wide COVID point in which we all shared information related to COVID. From the community-facing side, we quickly stood up a COVID-19 lifeline, frequently asked questions, and various other channels of patient communications. One thing for certain during these times was that everything was evolving at lightning speed. Weeks seemed like days. Next slide, please. With our COVID-19 response activities moving ahead, we really wanted to understand what questions, concerns our patients had in regards to COVID-19. In mid-March, we called Libby and Lindsay, and within a day, asking for their support in a question gathering exercise and eventual focus group that together made up our COVID-19 Patient Family Engagement Collaborative. The goal of this is to learn of the unique challenges our patients were facing during the COVID-19 pandemic to better align communications and resources. The activities from this collaborative included surveying patients and patient family advisors across our system and conducting a patient focus group. The survey itself was framed up to learn of the questions our patients were having, to explore what challenges our patients and the people in their communities were facing, and learning of any other concerns they had regarding COVID-19. Questions our patients had were as follows. I focus on my mental health and stay connected while social distancing. Who is the most vulnerable? What is the safest way? Can I access supplies and resources safely? How is COVID-19 spread? Can it be spread through the eyes? Where can I find information about COVID? What are the safe practices for people experiencing homelessness? What are the safe ways to keep healthy and exercise indoors? Themes that arise from these questions was that our patients wanted additional information on essential resources, such as how to obtain cleaning supplies and groceries. Another theme, where could they trust their sources of COVID-19 information with so many different avenues in both news and social media? We shared with them ours at Los Angeles County Public Health Communication Resources and social media channels. Another theme that arose was where our patients could get their prescription refills. We provided information on how they can get their prescriptions via the mail through our prescription mail delivery service. Another theme that came out of this collaborative was mental health wellness, for which we were able to align resources from our other sister agency, Los Angeles County Department of Mental Health, establishing the identified. We learned a lot from our patients and through this collaborative and leveraged this insight to strengthen our patient communications in various channels. Now I would like to introduce to you one of our patient family advisors, Sergio Quintanilla. He will share with us why he chose to support our patient family collaborative and how this experience was for him.
Hi, thank you for having me on. I appreciate it. So I wanted to share with you the why as to why I joined. And as soon as I had heard of this Patient Family Advisory Council from my clinic, I was very interested. The idea of meeting in a group, sharing ideas on how to improve my own clinic, it sounded like a really good idea to me. So it sparked my interest. And in fact, it sparked my interest a lot because I have what was brought up on one of the slides was lived experience. As a child, I battled with cancer. So I was in and out of facilities. Now in my early 40s, I was diagnosed with heart failure. And I also have a lot of family and friends experiences throughout my life of dealing with them in these medical facilities. So I've been around a lot of medical facilities, and I have a lot of respect for both sides, not only the patient side, but also the provider side. And so joining the Patient Family Advisory seemed like a good way to get more insight on how all of this works. I was very curious. And ultimately, I have a desire to help and to inform people. I felt that whatever I could learn from this group, I can share with my loved ones or with my family and friends, or even contribute something. So that's why I wanted to join this group. And how I joined it was really easy. I was just at a nutrition class, and the nutritionist had mentioned this group, and it caught my attention. And I inquired about it. I filled out some paperwork, and immediately after that, they contacted me, and they were very engaged with me to be a part of this. And I really enjoy this, being a part of the Patient Family Advisory Council.
Thank you, Sergio, for sharing that. So in closing, thank you to everyone in the workshop for allowing us to share our story and how we supported a patient-family engagement collaborative during this pandemic. And a gratitude of thanks to Liz, this whole collaborative for beginning to end. Please stay safe. Thank you.
Thank you so much, Miguel and Sergio. Really appreciate you sharing this practice of gathering questions that patients and families have. And I really commend the way that we were able to address those questions and get information out. And one thing that I really saw from all of this was the development of leaders, patient and family leaders within Los Angeles County, like Sergio, who can now take this information that those questions that all of these other patients and families must have as well, and start to share those resources that can really support them during this time. Such a great learning experience. So thank you both for sharing that with me. So I see a lot of great questions coming in. We're going to do a quick panel discussion. I have a few questions, and then if you have any other questions as well, please put those in the chat and we will address them as we move forward. So my first question is for our staff members. So I'll start with Chrissy first. How did the Patient Family Partners change the organization's response to COVID?
I think there were a lot of ways that they've changed the response. And we did cancel our initial March and April meetings, and we've restarted all of our 19 councils back up again. But even having the partners as part of the task force was, just bringing in that patient family perspective of the things that we're not looking at. So as far as like the visitation guidelines, and this is, as patient family advisory councils, we talk about visitation all the time, right? That's like a 30-year discussion that's still going on. So that was a particularly sensitive area. And for valid reasons that all of us are aware of, my loved one's dying and I can't come see them, or I need the CMO's approval in order to do that. And parents that were worried about grown, medically complex, nonverbal, children that would be admitted to the adult side where no visitors were allowed. And there were exceptions to some of those rules, but just looking at what was going out to the public, we were like, wait a minute. Again, like I said in the presentation, there's things that we have to get done, but it's taking that softer approach. And the soft side of medicine is just as important as the hard numbers and everything else, and that side of medicine. So I think that is one of the really big statements that we were able to make. And, the fact that our leaders even said, we need our partners right now more than ever. I mean, that's what I was told. And again, as I described, this was the expectation that our partners would be involved. It wasn't something that I necessarily had to ask someone, can we please? They knew that by putting me in charge that we would have that involvement. And they did make that tremendous input, and working just like with Lisa, she was a staff member, just picked up and took it on herself to get the things done and start collaborating with a number of the physicians. It was just amazing and incredible to watch.
Mm-hmm. Yeah, that's really interesting, Chrissy, because you mentioned that it was just an expectation. This is how we work. And I think that really speaks to the culture that has been developed at university hospitals over these many, many years. So, and I know that has taken time, but I think that really speaks to the culture that you've built. With on the other hand, we have Los Angeles County, and Miguel, I'm curious to hear your thoughts around this because DHS has been really moving towards a patient-family engaged culture, but is still on the newer side of this journey. So I'm curious with this such a big issue of COVID-19, how did these new patient-family partners change the health system's response to COVID?
Lindsay, I think, the patient family advisors definitely strengthen and for sharing the communications that we're sharing with our community are patient-centered. With information evolving so fast, it's important that we stay focused on providing information to the value and resourceful. Yesterday, we're just getting back online with our patient family advisory councils. They're meeting virtually currently. Yesterday was a meeting that our Mid-Valley or San Fernando Health Center group had their first virtual PFAC meeting. And within it, one of the agenda topics was sharing information on how to better communicate the safety measures that we're taking around in setting up the, so, getting that insight and capturing that insight from our patient family advisors is definitely strengthening our communication.
Mm-hmm. Yeah, I completely agree. And I understand many advisory councils have probably taken a pause during this time. We know that staff members have been dispersed to other areas within health systems and need to focus there. So it's an exciting time to now come back together and be able to focus on coming back and being seen and getting back to the new normal, as we'll call it. I want to go to the advisors now. Lisa, thank you so much for sharing the project that you worked on. I'm curious, as an advisor, what do you feel personally has been your biggest impact throughout the process of partnering with the organization in this way?
I think there's two main things. One is bringing up the patient and family perspective in the various communications and policies and just urgent issues that come up. As Chrissy alluded to, obviously we're all dealing with the reality of the limited visitation and we understand why. And so kind of being able to bring up different perspectives in a really mutually respectful, thoughtful way has been, I think, fulfilling for me and I hope helpful. And then the other thing is, I hope that in a way my working on these kinds of projects kind of helps expand the staff's ability to do things almost like another staff, but as a volunteer during a very stressful time when staff are stretched to the limit, working on so many things. And I also did some things like doing some research on my own that I was able to bring up. I attended an interesting COVID webinar with healthcare leaders where they were just as an attendee and then shared that information to the group. Mm-hmm. So hopefully that's helpful. And I also, last comment is just, I see some chat in the chat box. I think one of the things that's helpful in terms of advisors is when we already have gone through an orientation process, like we're already partners, then we already know a lot of these things that include the HIPAA, the confidentiality, et cetera.
Right, that's a great point, Lisa. Thank you for sharing. And Sergio, I'd like to hear a little bit more about your experience in partnering this way with LA County DHS. How do you feel you made an impact as an advisor through the completion of the survey and participating on the focus group? What do you feel like your impact has been?
To be honest with you, I feel that my impact has been quite significant. I believe I've been helpful because not only did they listen to my voice was heard, but they took my suggestions, they implemented these suggestions that I had, and after carrying out these suggestions, they came back and shared with me the results of what we talked about. And as a result, like I really feel like I helped people not only to like sign on to the My Wellness portal or just to let people know what's out there and what's available to them. But I really feel that being a part of this group helped me and helped them to have that impact on the people in our clinic.
Mm-hmm. That's a really great point, Sergio. And I think you made a great point in saying that you were able to see the impact that you did have. They showed you what was done with the information that you shared with the system, which is so important in closing that communication loop. Great. And Miguel, I'm curious looking back because we supported you in this effort a little bit and we just hit the ground running. I think a lot of organizations just hit the ground running when all of this started. So I'm curious looking back at that rapid need to respond to the virus, is there anything that you or the system would have done differently?
I think diversity, right, is important for us as we continue our work in expanding our advisory councils and assuring that we get a representation from all members of our community. During these types of collaboratives in the future would be a goal that we mentioned. But we just started our patient family engagement culture journey in January of last year, really by participating in PFCC's collaborative. We completed it in June of last year, so we're really approaching our 1-year anniversary of establishing PFAC, across our system. But diversity is very important for us. I think exploring ways to capture different demographics of these focus groups to inform different leaders of the system will be something that we look forward to doing in the future in this work.
Great. Thank you, Miguel. That's a really great point. I see a lot of great questions coming in, and I'm going to get to those shortly. I just have a few more for our presenters. And if we don't get to all of the questions that are in the chat, please know that we are recording today's session and we'll share that after, and we will follow up with answers and responses to the questions that we don't get to. So Chrissy, I wanted to go back to you. I'm curious how in the future will patient family advisors influence or continue to influence other programs across university hospitals?
The last couple weeks have been really, really interesting because I could feel the work of the task force starting to dwindle down. We got so many things achieved. We accomplished so much. And I was sort of like, okay, well, now what? What are we going to do now? Is there still things going on? So interestingly enough, our chief clinical transformation officer reached out to me and said, we're going for this grant through AHRQ and we need an ad hoc council. So can we start, working with institutional relations and development, getting these letters together and applications together for our different partners to have this done. So people are still thinking about how do we engage our patient family partners in just every day-to-day work that we're doing. In addition to that, under him as well, we are starting a Healthy at Home campaign, which they want me to lead again, as far as how we are going to be teaching the community why it's better for you to be discharged to home than going to a skilled nursing facility. So the information, the annual infection rates and deaths in skilled nursing is near 300,000. So that's not even including the inpatient world of hospitals when we're looking at up to near 440,000. So what those benefits are and what our home care services can offer, to keep people healthy and at home and out of the hospital. And then I just recently followed up with a head nurse and a quality improvement nurse that said, you know, we're reinvigorating our falls work, and we know that the Acute Care Partnership Council developed the My Falls Safety Plan a number of years ago. We need to re-energize, so how can we start getting people more involved in falls again? We need that patient-family perspective. So there's still, again, it's that culture, so they're still thinking of, well, we're working on this project, where's the patient-family perspective? How are we going to engage with the councils? And the other thing that also, you know, there's many silver linings that have come out of this pandemic. I'm sure all of us could name about 20. But what I've been looking at too is I'm getting all of these big requests now, is for a number of years I've wanted a system level council, and we're going to do it now. So that I would be the staff liaison. I would help to lead that group. It would just meet quarterly, but a main central group that I could go to just bounce ideas off of and get their input, you know, in how we're designing things. So I think, again, it's just part of that culture, and we will just find ways to still keep them involved.
Mm-hmm. And continue to grow the overall program as well, it sounds like.
Yes.
And so, Lisa, on the other side, how do you hope to partner in programs like these, like the overall COVID response in your health system at university hospitals in the future?
I hope to be involved in other projects and councils like this, and keep on learning and partnering and hopefully helping people and pursue some of the other issues I'm really passionate about, like helping people with disabilities and transition to adulthood.
Wonderful. Thanks, Lisa. And Sergio, same question. I'm curious how you hope to partner in more programs like these at LA County.
Well, one thing's for sure is that the future of our healthcare is completely evolving, especially nowadays. So collaboration between patients and providers needs to evolve as well. And I would love to be a part of that, as long as you guys keep inviting me to attend these things. I enjoy helping out and seeing progress and helping.
Wonderful. Well, that's a great quality to have, to be a patient-family advisor. So we appreciate you. I'd like to bring Libby Hoy into our conversation. I know there's a lot of chat conversation going on that she has been monitoring for me, because it's going fast. So Libby?
It is. There's so many fantastic programs that people are sharing all over the country, how advisors are being involved in the COVID response. And I want to just plant this seed, because it was planted for me very firmly this morning with a conversation with advisors from the PFA network. And that is, there's a lot of folks with chronic care who have had difficulty accessing care during this time. There's a lot of health systems I've heard from concerned about how are they going to bring back people and to feel safe in the hospitals and to feel safe in their primary care settings and their specialty care settings. And so I think I just, want to keep this space open for patient-family advisors to continue to be very active in not only how do we go into this next phase, right? It's going to look different. Things aren't going to be the same as they used to be. And that's okay. I agree with Chrissy. I think there's some silver linings we need to really magnify and attach to. But I think it's really critical that advisors move into these next level activities, right? As we move out of this response phase and into this new development phase. It's a critical time for patient-family voice to be partnering in sort of what comes next. So just kind of want to plant that seed. But yeah, there was another question about PFACs addressing the allocation of scarce resources, such as ventilators. Have advisors been involved in those kinds of conversations? If anyone wants to respond.
So Libby, this is Chrissy, and I know I've been going back and forth with David privately with that question. So we did not have any of our patient family partners involved, but I will say it was talking to some of my national colleagues when this all started. I would get texts from them or calls, and it would be like, "Hey, did your position become like seriously important overnight?" And Yes, it did. I mean, not that it wasn't before, but just in a different type of way that it became important. And shortly after I had been given the task of leading the task force around maintaining our patient and family centeredness, I got another reach out from one of our chief medical officers at one of our community hospitals saying, hey, we need you to be on the system resource allocation committee. You are viewed as the patient family advocate and we need your input. So I was involved, and actually the policy that we are putting together is being done in conjunction with our other major medical centers here in Northeast Ohio, so Metro Health, Cleveland Clinic, SUMA, and that policy then will, we need to look at it and make it more patient family friendly. So that's probably when we'll start pulling in some of the partners to review, because then that policy will be made available to the public. So they know exactly what Northeast Ohio will be doing if we hit that surge, and hit capacity, which luckily we haven't yet.
Thank you, Chrissy. And it does look like there's a couple folks in the chat box, Caroline and Richard James, who have been able to be a part of their ethics committee. So I know we're running extraordinarily short on time, but perhaps we can follow up with the two of you and learn a little bit more about what that looks like. I also want to underscore the diversity. I've seen some comments in the chat box, and I agree that the pandemic has certainly highlighted inequities in care, and we need to address those, and we need to be creative as a community about how we engage those voices of folks who haven't traditionally been at the table. I think, we're really thinking strongly about connecting with community-based organizations as a trusted source to those communities, as colleagues or collaborators in this space, but much more to come and much more work to be done in that arena. So thank you, Caroline. And Richard, we'll follow up with you. Lindsay, I'll give it back to you.
Oh, no problem. No, that is great. Well needed discussion. So look forward to following up and learning more. In our last 3 minutes, I just had one final question just to address some of the concerns that health systems may have about engaging advisors in emergencies like this. One reason that we've heard is that they don't want to take up advisors' time or don't want to bother them with a hard request. So I'm curious, what advice would you give colleagues who are hesitant? And so we'll start with Miguel and then go to Chrissy. Miguel?
Sure. Thank you. We feel that, that during these times, these hard times, is when we need the support of our patient family advisors the most. Moving parts to these types of events, we want to make sure we get our patient family advisors insight to make the moves that align with their needs. My advice will for help and support. And, you may be surprised with their answer that they're more than willing to help and be there for us.
That's a great point. Thank you, Miguel. And Chrissy?
Thank you. I really like this question, and I will quote one of our patient family partners, and actually who's building her own national reputation, Nikki Montgomery, who said, it's up to us to decide what we want to be involved in. Just ask us. And if it's something we're interested in, if we have the bandwidth to participate, then we will. And if not, and if we feel like we're stepping out of our area and on shaky ground, skills exchange, thanks again, Libby, that, I'll decline, or maybe I'll refer you to a different partner that might be interested. So really it's let the patient and family advisors decide what they want to be involved in.
That is a great point to wrap us up, Chrissy. So thank you very much. Thank you to Chrissy. Thank you also Lisa and Sergio and Miguel. This has been really insightful, and I really appreciate you all taking the time to share with us. And thank you also, Libby, for setting up for a wonderful conversation and presentation today. We're really excited and appreciate everyone for joining and all of the enthusiasm around what we have shared with you today. So thank you so much. Before we go, I just wanted to do a few quick announcements, reminders. We have our June workshop happening Friday, June 26th, same time, same place. We will be joined by the Connecticut Hospital Association, who will be talking about their patient family engagement innovation units. So more information to come on that, but just a quick reminder. And then finally, the PFCC conference has been moved to a virtual platform, just like many other conferences during this time. So we're really hoping that this actually opens the door for even more of you to join us and learn some really inspiring and innovative PFCC strategies that you can take back to your local organizations. Again, more information to come on that, but still save those dates. We're still going. And with that, we're right at 1 o'clock. I again want to thank all of you for participating with us today and thank our presenters as well. I hope you all have a safe Memorial Day weekend.